Okay, our next topic is domestic violence, and now we will talk about the general approach towards all the scenarios. While working as a GP, you may see many patients coming with unclear signs and symptoms, and especially in cases of the females who are pregnant, I think we need to keep the suspicion very high of the domestic violence because it is not legally allowed in the UK. So there are many signs and symptoms that may be suggestive of domestic violence. Whenever we see any patient, we need to consider those things. Domestic violence is illegal. Um, Anyone can be victim. It can be the victim can be male, female, or can be child, adult or child. So anyone can be victim. Now we are going to focus more on the domestic violence where the females are involved. It can be in any kind of marital relationship, can be partner, civil partner, or can be the married couple. So we need to consider, we need to talk about where we need to consider those situations. General approach towards any patient who is coming uh, with any complaint. Do not be judgmental, be always build a good rapport, and try not to be judgmental, try not to be investigative towards the patient. And whenever you see any patient where you see any suspected or suspicious symptoms, ask about the home circumstances, ask about the general relation with everyone living at home, with the child, with the husband, with the partner, or maybe sometimes in-laws, whoever is living at the household. So that's very important. There are a few things that we need to consider when we see any patient, especially in case of the female who has come to you. They may not be very much open. They may not be ready to speak to you. If you find any obvious symptom or the sign where you can suspect domestic violence, keep the suspicion, keep your threshold very low towards investigating and looking into all those sensitive matters, and take a very careful approach. If the patient is not, if you see any patient who is coming with very unclear signs and symptoms or the complaints, like coming with insomnia, not feeling self-esteem, tiredness, these are actually the symptom, and it does not really give you any significant clue towards any pathology. So these are where we need to consider whether the patient may be a victim of the domestic violence or not. In few cases, when the patient is not open to you, you may need to struggle a bit. You may need to offer them confidentiality, offer them privacy, and create very good rapport with the patient. That's the core thing in your consultation whenever you see such patients. And if you find any evidence from the discussion, from the consultation, try to find out what the patient has done, or is it the first time it happened, or has it been a series of events when this has happened, and is there any particular reason why the patient had been tolerating if violence had occurred in the past as well. And also if there is anyone at home who is also a victim of that, especially when we talk about, when we are considering domestic violence, it is not the individual thing. Most of the time more than one person is involved. So especially in case of the mom, it can be the child as well. So we need to find it out. Sometimes the domestic violence may not be very clear. There are several signs and symptoms of the domestic violence. Domestic violence can be of any type. It can be just emotional violence, it can be threat and intimidation, it can be physical or the sexual violence. So we need to consider all those things whenever we see any patient. This is a mnemonic that you can use if the patient is not violence, and kick is also the physical violence. So These are different questions that you can ask, especially if the patient is not speaking to you, does not want to talk to you. Maybe sometimes they need a little vent. After you ask them one single question, they will open up. Make sure that you build a good rapport and you create very good relation with the patient and offer them the confidentially. That's the main thing. And after the patient speaks up, there are quite a few things that we can offer the patient, especially in terms of where they can get the help being victimized or when they are at risk of being victimized. Talking about different types of violence, as I mentioned, emotional violence can be in the form of when the partner or whoever is the subject who is causing the violence causes belittlement and causes a humiliation of the patient, and they do not simply recognize their personality. They may let the victim down on different occasions for everything, and there is no clear reason for the conflicts. And sometimes the patient may even not be aware of that. So emotional violence is kind of that usually leaves symptoms in terms of in the form of depression and sleep disturbances, mood disturbances. So checking the mood and asking the patient to score their mood is also very important, so you can find out if the patient has low score or good score. So ask them to tell you how would you score your mood from 0 to 10. Ask them, do you enjoy the things that you normally used to, and ask them how long this had been happening. Was there some incident, and was any particular reason? Sometimes it may be because of some reasons. Most of the domestic violence is start during the pregnancy period. It can be the first pregnancy, second or third. If you see any patient who is coming with the pregnancy and the vague symptoms, and you're not really very clear what's going on, always suspect domestic violence and try to explore a bit more, because a pregnancy may be one of the reason. Sometimes there may be the unplanned pregnancy, so you need to find out if both the partners are happy for the pregnancy, and do both of them want to go ahead with the pregnancy. Sex violence can be in different types. It can be in the form of when the partner wants uh, different rules for the sex, or when they may be in the form of that they do not like the way the victim wants. They might want to use a different route, different ways and different techniques, this and that. So all those things are the signs and symptoms of domestic violence, and especially the sex violence. Okay, it may be when the patient does not want to have the sex and the partner wants. That's also a sign of sex violence. Sometimes you may see some bruises, some signs of injuries on the patient which are normally not explained. Uh, so you can ask them. These are essentially the signs of physical abuse. Emotional abuse can be sometimes threats and intimidations can be in the form of when the partner asks them, and they ask them to cut them off from their family, from their friends, and kind of thing. They do not want the patient to socialize. They just limit the life of the patient just to one single house or one single room. So these are all the forms and signs and symptoms of different forms of domestic violence. So we need to keep our threshold very low when we see the vague complaints. That's the main thing that I keep asking, I keep saying, and stressing on. So any vague symptom where you do not find any reasonable explanation means that the patient may be a victim. So the core things in that: build very good rapport, do not be judgmental with the patient, do not be interrogative, offer them help, offer them confidentiality, and guide them what they can do in case if they are under stress, in case if they need any help, if they think that they can become serious victim of the serious violence. So in those cases, what they can do, so there are few people, especially if this is a matter of the pregnant female, so there are few people that they can contact, including the GP and the health visitor, social worker, and their doctor, like the obstetrician, and they can contact the helplines as well. So there are a few organizations that are there to help such victims, that include the refuge, that include women's aid refuge, and there are a few other, like Gallup for the LGBT. And for the male, sometimes you may see male patient coming with the vague symptoms. It is not always a female. So sometimes if a male has come with a vague symptom and you think that the patient looks upset, looks anxious, so you need to keep the suspicion very low of the domestic violence. And in cases of male, there is a helpline called Men Advise, so they can contact there. There are few helplines that you can offer them, the contact numbers you can offer them. Always make sure that you remain sympathetic and empathic towards the patient, and do not be judgmental, I keep saying. Okay, so those are the main thing. Take detailed history. Do not simply ignore the signs and symptoms, the presenting complaint as well. So you need to explore first of all. If after exploration, after asking the questions, you do not find any significant clue, then you come to the domestic violence. Do not simply ignore from the very beginning and go in your exam with the preoccupied mind that, oh, this is a vague symptom, this looks a vague symptom, and this is likely domestic violence. Say, for example, if the patient comes to you with the pervaginal bleeding and she is pregnant, you need to take the history of PV bleeding first of all. And if you do not find any evidence, then you need to talk about, you need to think about the other things as well, especially ask about the home circumstances, relation with everyone living in the household. Those things are very important. Okay, the management in such patients can be, wherever you suspect any problem like the domestic violence, always inform your colleagues, inform the senior, get advice, and before you raise any concern, you need to make sure that you are not doing anything wrong that may uh, cause a conflict at home. So always make sure, and this is a patient choice. You tell them how to get the help, and you tell them what are the helps available. This is a patient choice. Always encourage them to decide. Do not force them to do whatever you want. Okay, so this is actually the patient choice. You are there to guide them. In some cases, yes, there is your responsibility that you may involve the police or you may involve the other services without regarding the confidentiality, especially when you think that someone who is a victim of serious violence, like if someone's life is at risk, and also especially if there is involvement of the children. So when it comes to the safeguarding of the children, safeguarding of the victim, then we may sometimes end up breaching the confidentiality. However, that is not the last thing. That's so we need to always check with our colleagues and get the advice from the colleagues and see what they suggest. Now there are a few options that we can mention, as I mentioned before. There's multi-agency risk assessment conference and women's aid, Gallup, and men advice line. So these are the options that we need to mention. That's all about the management. However, the management will vary from case to case. So let's now discuss a few examples